Thank you very much, Dorica, for your nice presentation. Thank you very much, Arabella, for the invitation to join you today here. And I will start my presentation. Just a second. So I'm allowed to share my screen.
Yes, you should.
Okay. So now can you see my presentation?
Yes, we see.
Perfect. Because now I will put it on a slideshow and it will be better. So thank you very much again for the opportunity to be with you here today. And during the next few minutes, I would like to make together with you a journey in the complexity of genetic testing in neuromuscular diseases. The topics that I want to talk about today are a brief review of neuromuscular diseases, the link between genetics and neuromuscular diseases, and how we can use genetic testing in the diagnostic of neuromuscular diseases, taking here looking here to few details like genetic methods, genetic testing algorithm, genetic counseling, and familial genetic testing. And I will outline the importance of multidisciplinarity in neuromuscular diseases, and just to show you all these ideas in practice. I will present a case report with a neuromuscular disease that was managed in our center. So, neuromuscular diseases are disorders of muscles, neuromuscular junction, nerves, and neurons from the central nervous system, and that's why the clinical presentation of these pathologies is very heterogeneous. It's complicated. Usually, it's very complicated to give the proper clinical diagnostic and to put the proper name of the disease. The majority of these neuromuscular disorders have a genetic cause, a genetic background, and these genetic causes are most of them inherited or transmitted in a Mendelian way. So they are caused by mutations in genes that can be transmitted in a dominant or a recessive way. I will outline this a little bit later in my presentation. So, because most of these pathologies have a genetic background, a genetic etiology, genetics plays an important role in or might play an important role in the diagnostic and management, but is not the only tool that we have to use in the diagnostic and management of this kind of pathologies. As I've mentioned, what is so we are, as I like to say, we are a library with 46 volumes, with 46 books, and these 46 books are arranged in pairs. Each pair each book pair has two variants, a maternal one and a paternal one. And in all these books, we have stories that we name in a scientific way genes. These genes are can be sometimes can contain errors, typing errors. The letters from them can be substituted, deleted, or duplicated, and this might and these are named or known as gene variants. These gene variants can be inherited or they can occur de novo. In all this library, in all these 46 books, we have around 30,000 stories or genes. And from these stories, at this moment, we know that around 500 of them are involved or are causing neuromuscular diseases. The number is changing very, very fast because the progress of technology and of science help in this direction. Medical genetics, because of this, is a very important tool. Medical genetics is a medical specialty that can offer clinical help and clinical diagnostics, but in the same time can confirm through laboratory tools the clinical diagnostic. And it has two components or two arms in this specialty, but all these phases of medical genetics have as main target or main activity not only the patient, the individual, but also his or her family, and in this way the entire population, because a genetic disease is not only the disease of the individual, is not affecting only the individual, it affects the family and also the people around. So it's important to have and to find the genetic cause of the pathology. As I've mentioned, the variants that can be found in the genes in our stories can be inherited or can be de novo. And if they are inherited, then it can be inherited in a dominant way or in a recessive way. If we talk about the books that, or the chromosomes that are, let's say, we call them autosomes. So, but they are, if we refer to the books that are involved, are responsible for saying the gender of the person, X and Y chromosomes, then we talk about an X-linked recessive, an X-linked inheritance that can be recessive or dominant, or we can talk about an Y linked inheritance. And also, we have an extra book in our library, and this is not this book is called the mitochondrial DNA, and this book contains also stories, genes that can be also involved in or can be involved in developing or causing neuromuscular disease. So it's important to know all of these data and details, because that's why there is no perfect genetic test that can offer us from the first moment, from the first time, the diagnostic. Yes, maybe we can say, no, this is not true, because now we have whole genome sequencing that can offer us in the same time the assessment of a point mutation, with copy number variation, with so small errors, with big errors, or and in the same time the mitochondrial DNA. Yes, it's true. This is one of the most complex genetic tools that we have now, but sometimes there is something else that can cause this pathology, and we can talk about epigenetics, but this is not what I'm going to develop more, because it's complicated. So this is the way that the genetic variants can be inherited or can be transmitted from one generation to another. That's why through genetics, through medical genetics, we can help to prevent, to have an early diagnostic and proper management for genetic diseases. And we can help not only the person that is tested at the beginning, but we can also help the family and the population from the region from where the patient is. And now, having in mind this library with the books, with the stories, and with the letters that are used to write these stories, I will present you a little bit about the genetic tests that can be used for the diagnostic of neuromuscular diseases. First of all, why to make a genetic test? Because we want to confirm a diagnostic of that was clinically suspected based on the phenotype that the patient or the individual presented. But in the same time, we want to offer a personalized and management of the individual and his or her family in order to achieve a high quality life. We can also, through genetic tests, avoid invasive or painful procedures, such as muscle biopsy, but not always. This might be possible because sometimes after negative or uncertain result, the genetic test, but with a very let's say specific phenotype of the case, muscle biopsy is needed and can help. And in the same time, we can give the opportunity through genetic test to the patient and his family to make family planning, but also in the same time to participate in research studies dedicated for that specific condition. Also, disease management can be helped because we can try to provide prognosis for the severity and the progression of the disease, and we can guide sometimes the treatment and the management based on the genetic test result. As I've mentioned, because the genetic causes that can produce a neuromuscular disease can be from the can be some of them very big, like dimension, but some of them very small. So if we look to the if we use again the idea of the books, sometimes chapters might be missing or might be extra in a book, but sometimes in a single story, in a specific in specific coordinates, one single letter can be can be different, can be changed, can be substituted by another letter, or can be deleted, or can be duplicated. And this is a very small genetic variant that requires, let's say, specific genetic methods to be identified. So there are a lot of methods, genetic methods that were developed and can be used in the diagnostic. So the first genetic methods were the cytogenetic methods, the karyotype. Then the karyotype was improved, and it was developed the molecular karyotype that can detect the first one, the classical karyotype can analyze the books, the library, the entire library, can count the books, and can say that there are missing or are extra big parts of the books there. After, the molecular karyotype can count chapters in each books and can say extra that there is a chapter that is missing, or there is a chapter that is duplicated. But if we want to read the books, we can, or to read a specific story from this book, we need other type of methods, of genetic methods. And these are the methods based on sequencing. And if we want to read a single book, a single story, or we want to look for a single variant in a specific story, we can use capillary sequencing methods because they are, let's say, cheaper and faster. But if we want to read all the books from our library, to read huge stories, huge genes, and we do not know where to look first, because there might be many genes that can be involved in the phenotype of the patient, then next generation sequencing methods are those that can be used and should be used. Because if we use other type of method, then the result will be negative, but not because it's nothing there, just because we didn't choose the proper method. If we look to the NGS, to the next generation sequencing methodology, that is one of the most complex and strong and powerful method, we can choose to analyze a specific panel of genes that are very well, that are strong associated, very strong associated with neuromuscular diseases, or we can choose to analyze the whole exome or the whole genome if we want to be sure that we analyze all the genes and all the regions of our genome that might be associated with this kind of pathologies. And of course, if we talk about whole genome sequencing, we can include also the analysis of mitochondrial DNA that can also be involved in the development of neuromuscular pathologies. The genetic testing algorithm is complicated because of the things that I've mentioned before. There are a lot of questions that we have to answer before we choose and we say, this is the genetic test that you should do, or I recommend to you. It's important to know why we test, what we test, who we test. Is the person is affected or has the history, has a familial history for a disease, a neuromuscular disease. When we want to do this test, prenatally, postnatally, we want to make a screening. and how. When we have the first time when neuromuscular pathology might be suspected, usually is in childhood, and the first specialists that can raise this suspicion are the child neurologist or the pediatrician, and they and it is recommended to have, for those cases where is this kind of suspicion, to have a multidisciplinary assessment before genetic testing. Why? Because it's important to decide which test to do. Maybe we can say yes, we can recommend to all whole exome or whole genome sequencing, but it is about costs, but also about limitation of the methods, because sometimes even these two methods can give negative results, or can't give the response of which genetic variant is involved in this phenotype. So it's important to discuss in a multidisciplinary team, and only after this to decide the genetic test that will be recommended. And also, if we want to perform a whole genome or whole exome, ideally is to test the trio, the parents and the child, because it will be easier to find the variant that might cause the phenotype. And of course, we have to choose and to say if it's targeted or it's a screening, let's say a genomic screening method. As I mentioned, also it's important when we test prenatally, postnatally, screening, or preconceptional, because in each of these parts, it's important to know what we test and which is the proper method we want to use. Also, after we have we've done a genetic test, sometimes it might be necessary to repeat that test. And of course, we repeat the test if we performed just a targeted test, or we performed a panel gene test and not a whole exome or a whole genome. Because if we performed whole exome or whole genome, the approach is not to retest, the approach is to reanalyze the data in the context of new data in the literature and in the databases. Also, sometimes genetic testing can be done through research studies, and it's, let's say, just research use only the result. And if we want to have access to different to new therapies that are on the market, or we need sometimes, or to have the test done in a diagnostic laboratory. That's why it's necessary in these situations to repeat the test. And of course, in some clinical trials, the methodology of these ask for a new test to be done in specific laboratories, because these are the rules. Before, after, and whenever is necessary, genetic counseling is recommended, because during genetic counseling, individuals and their families can be informed about the limitations of a genetic test, the variants of genetic testing that are available, how can help the genetic test, and which should be the expectations we should have from the result of genetic test. Because it's important to know that in many cases, the genetic test will tell us only this is the cause, this from here everything started. And of course it's important because we can look and find arguments in the literature about a proper case management, but won't offer us a treatment option. And it's important to understand that and to accept this limitation for many of the situations. And after, and it's important to know, and genetic counseling will help us to understand that after we have a genetic result, we can test also members of our families if they want and they need the genetic test. And we can also, and it can be also necessary to test our parents, for example, or our siblings, if we are the first person in our family that was tested and where a genetic variant was found, because it's important to establish the inheritance mode of that variant. But always genetic testing is a personal decision. The genetic counselor or the geneticist just recommend, explain, but always the patient and his or her family will decide if they want to do or not the test. As I've mentioned, or what I wanted to outline through my slides, is that genetics and medical genetics recommends a multidisciplinary approach in the management of neuromuscular diseases, because the genetic diagnostic is just a small piece from the puzzle of neuromuscular diseases management. And the genetic test is just a strong tool that has to be used carefully and wisely if we want to obtain more advantages than disadvantages. And as I've mentioned, I will conclude with one case report from the Regional Genetic Center from Craiova, Romania. Is the case of a patient with clinically diagnosed with Charcot-Marie-Tooth. She came to genetics because she wanted to have the genetic confirmation of her disease, and because of preconception genetic counseling. So the first step, after we also see clinically, clinically the case, was to try to identify the genetic cause. And at that moment, because one of the most frequent cause of of Charcot-Marie-Tooth is a duplication in one gene in PMP22. We tried to identify, to see if we had identified this copy number variation, duplication of this gene through RACGH, so through molecular karyotype, and this result was negative. After that, the patient was able to continue with the genetic testing abroad, and she performed panel sequencing, gene panel sequencing of the most frequent genes that are involved in Charcot-Marie-Tooth. Also, this one was negative. Few years later, when we were able to implement and in our laboratory the next generation sequencing method, we were able to offer her genetic testing of a clinical exome. We named a bigger panel, gene panel, with more than 4,000 genes. And this is also known as clinical exome. It's not the entire exome, but are all the genes that are associated with specific pathologies. And this time, we find there a variant, a genetic variant, in a gene called NDRG1 gene that is associated with Charcot-Marie-Tooth type 4D. And when we compare the clinical phenotype of our patient with the clinical phenotype described in the literature for this Charcot-Marie-Tooth type and the gene, we could say that there is a correlation between the genotype and the phenotype of our patient, and that is the genetic variant that caused the problem to our patient. After this, we were able to offer her the result. We were able to counsel her and say which are the next steps that we and she and her family have to do, because there were several steps to perform. We validate first the variant found through this method using a targeted method this time, capillary sequencing. Then we continue to test the family, the mother, the siblings, and the husband, because this gene is, or the type of Charcot-Marie-Tooth 4D is transmitted, or it's autosomal recessive disease. So requires two errors, one on the maternal book and one on the paternal book or story, to cause the disease. And our patient was homozygote for the mutation, but it's very the probability that her husband to be carrier of that variant, it's, let's say, very low, but you never know, so you have to test this, and that's why we tested also the husband of our patient, and of course he was negative. We tested the family, the mother, and her sister and her brother, and all of them were negative, so wild type homozygote. They have no variant there. And of course, she we tell her that there won't be a problem if she obtains a pregnancy, but just to be sure, it might be better to test prenatally the fetal DNA in order to see that he or she carries only one copy of the variant and no other de novo variant occurred there. And this is what we've done. We've done also prenatal diagnostic, and of course the baby was heterozygous, so healthy carrier, and everything was with happy end because she gave birth to a very, very healthy boy and very beautiful. And we were able to solve a case, to solve not only a case, to help a family to be happy and complete. So we excluded the CMT4D in other members and in the fetus, and then the child, the unborn child, but he was born, and everything went okay because the patient, our patient was patient, and we were able to find all the tools that we needed to help her. But of course, there was some big time to wait between the tests. Our message is never alone. We have to work together, doctors and patients, in order to have an integrated multidisciplinary management of each cases. Thank you very much on behalf of the team of the Regional Genetic Center from Craiova. And if there are questions, here I am.
Thank you. Thank you, Ioana, very much for this overview of genetic testing and the example in the end with happy end. And I'd like to open the floor for questions and comments. If not, it means that everything
Dorica?
Sorry?
Yeah. Sorry,
Okay.
Dorica. No, just a comment. Very nice talk. Thank you very much. I just saw that in the process, at the end of your process, you were saying that once the genetic mutation has been identified, it's important to report this data in a registry. So I just wanted to share an information with everyone in this meeting. More and more, there are standards which are promoted for registries following a few principles called FAIR principle for findable, accessible, interoperable, and reusable data between registries. And so I had two information for you. First, the ERN Euro NMD, which will be presented tomorrow, I think, is building a hub where existing registries can connect and share their data. So that's very important for all the clinicians who are currently managing and building registries to know that it's still in the building process, but in a few months or years, hopefully months, they will be able to connect their registry to this hub so that the data can be shared at the European level as much as possible. The second thing is that when we talk about this FAIR data, that means also adopting certain standards so that they are interoperable between different registries. So tomorrow again, there will be a presentation of the registries by Nawel Lalout from WDO, or Duchenne Data Platform, sorry. She will show how they adapted the Duchenne Data Platform registry to make it fair. But more importantly, she will tell that the tools they developed has been delivered as an open source software. So it can be adapted to any existing registry. So if you have an existing registry and want to connect your registry and make it fair and interoperable with other registry in the world, you don't have to restart your registry from scratch, but you can use this open source software to put it on top an additional layer on your registry and then have it connectable to any other existing registry. So yeah, I think these genetic data are very important as we are talking about rare diseases, and to make sure that we clearly interpret these mutations, we need to be able to compare them with a lot of other patients sharing the same symptoms. And so again, data sharing is a very important thing.
Thank you very much. Just a question or maybe need of clarification. So the registry that you are mentioned is developed within the neuromuscular disease European reference network, no?
So yeah, I talked about two registries. So one is really the hub developed by the ERN, so the European Reference Network NMD. And as its name mentions, it's more a hub where existing networks, existing registries will be able to connect their data. And the second registry is the Duchenne data platform, which is a Duchenne dedicated registry, which had to be adapted to be connectable to the ERN hub. And to do so, they developed these open source tools, which allow any registry to be easily connectable to other registries.
Okay, thank you.